Hi, welcome to It Takes Guts. I'm your host, Stacy. I have been a gastroenterology nurse practitioner for the past 6 years, and prior to that, I worked in the endoscopy department as a nurse for 15 years. I love GI health. Today, we are talking about diverticulitis. I know I remember growing up hearing my grandma say, "Oh, I can't eat my corn because of my diverticulitis." How awful. What kind of disease that you can't eat corn? That's just terrible. Well, to know what diverticulitis is, we need to know what is diverticulosis. These are two very different things that sound very similar. Diverticulosis are pockets or outpouchings that can occur in the large intestine. You can get them in other places in the GI tract, but specifically in the colon. These can occur just from normal wear and tear. Most people, by the time you get your colonoscopy around age 45 or 50, I'd say about 50% of Americans will have at least a few diverticulums seen in there. A majority of them are in the left side of the colon. That's in the sigmoid colon, specifically the left lower portion of the abdomen. Diverticulosis, once you have them, they're there. They don't go away. There's nothing you can necessarily do to completely prevent diverticulosis except try your best to manage your constipation. We think that it may be more triggered by straining or more constipation. We do sometimes see, oh yeah, my grandpa had diverticulosis, my dad, and now I do. I mean, we will see it in families, but it's not necessarily a hereditary thing. So diverticulitis is when these pockets or outpouchings get something caught in them. Usually it's food or poop. And if something gets stuck in there, it becomes inflamed and it can become infected. That is diverticulitis. So people who get diverticulitis, the number one symptom is really significant pain in the abdomen. Most patients that I see with acute diverticulitis, they come in, they're like, my pain is right here in the left lower abdomen. It came on a little bit last night and now it's really bad. And a majority will say, I thought about going to the emergency room because the pain's that bad. Normally I tell people, if you think you might go to the emergency room, you should go. What they would do at that point is get a CAT scan. Emergency rooms are notorious for scanning just about anybody who walks in. But specifically, if you're saying, yeah, I have abdominal pain, they're going to do a CAT scan. And this is how you diagnose diverticulitis with certainty. We can go based also on your symptoms. If you just had your colonoscopy and we're like, oh yeah, you had some diverticulosis in there. And then 2 weeks later, you're coming in, I have the worst pain. Well, then most likely it's diverticulitis. Sometimes it can get worse. Sometimes it can resolve on its own. We used to put everybody on antibiotics almost immediately to treat it. The newest guidelines, like within the past couple months, say, hey, if you're coming in with acute abdominal pain, it seems like diverticulitis, instead of throwing you on an antibiotic, because we know putting you on too many antibiotics in the long term is not a good thing, why don't we try treating your symptoms, putting you on a low roughage diet, actually go mostly for soups and boring foods and a lot of fluids. Make sure you're moving your bowels because most people will get a little constipated with a diverticulitis. So keep your bowels moving, a little pain medications. Again, you have to be careful with opioids or any narcotics because those slow the bowels down. It can definitely help with the abdominal pain, but you want to just not be on that for more than a couple doses maximum. It can really cause the constipation to be worse. And then, hey, are we going to not heal things up because you're not pooping? But if we can get you feeling better within a couple days of doing really a boring diet, a lot of fluid, a little pain medicine, moving your bowels, great. It can resolve on its own. However, if that's not helping, then we want to give you a course of antibiotics because at that point we're risking it's turning into an infection. We need to get it taken care of. Every once in a while, people will end up admitted to the hospital with this because it just got really severe really quickly. It's not like, oh, I had it for weeks and didn't do anything. No, I had pain and boom, I suddenly had a fever and I couldn't stand up. That's definitely worth getting your bottom to the emergency room. Sometimes people need to be on IV antibiotics. Now, back to my grandma's story. I can't eat corn because I have diverticulitis. That is not true. This should be some of the best news to everybody out there. You do not need to avoid nuts, seeds, any fruits with seeds. You do not need to avoid corn or popcorn. This has been something that has been told to us for years and years and years. And you know what? We found it didn't matter. Didn't make a bit of difference. However, as is the key with most things in life, moderation. If you go out and eat a gigantic bag of pistachios, yeah, you might trigger some diverticulitis, but that's because you had a giant bag of pistachios. That's not a serving size. Moving your bowels regularly is how we really prevent bouts of diverticulitis. At least that's what we think. We don't really have 100% treatment or prevention. Yes, we can treat it. Prevention for diverticulitis, the best we have is keep your bowels moving, prevent the constipation, plenty of water, high fiber diet, which I feel like has come up in every video just about now. A lot of fiber, but make sure you're drinking a lot of water with this. It keeps your bowels moving, less likely to get food or stool caught in those pockets. You do not need to avoid any particular foods. Can you prevent diverticulitis 100%? No, you can't. So you do the best you can. Once you have a bout of diverticulitis, there's always a chance you might get it again, but there are some people who might never get it again. So that's wonderful. As far as when would you need to seek attention? If you develop any of the things that I talked about, you are fine. All of a sudden, ow, I have this pain in my left lower abdomen and it's not going away. If you're like, yeah, it's lasted, 5-6 hours, something clearly is wrong. Or specifically, it's now lasted 24 hours. You need to get in to see your primary care provider, get in to see your gastroenterologist. If at any point you're like, this is really severe, I'm in a lot of pain, I'm scared, go to the emergency room because they can get you some medicine faster and get you scanned. So that is really it today. Diverticulitis, you have to have diverticulosis to get diverticulitis. If you are a lucky person who had your colonoscopy and it looked beautiful like a newborn baby's colon with no diverticulosis, good for you. Keep up the good work, whatever you're doing, probably a high fiber diet. If you do have diverticulosis that your doctor told you about, no need to panic. You are just going to continue making sure you keep your bowels moving, get your fiber, your water, and then obviously if you develop any symptoms, you contact your doctor or your nurse practitioner. So please like and subscribe to the channel. Leave me some comments. Let me know some things that you would like to hear about. If you're curious, if you have any more questions. And please remember, I would love for you to be informed, educated, and know that you are not alone.